Hello and welcome back to my channel. In this video, let's discuss about an important and neglected symptom called anemia caused by low hemoglobin levels. It is quite common in India, especially in women. However, most of us are not aware of it. It is only during any routine health checkup or blood tests that we get to know that we have anemia. A slight decrease in hemoglobin level does not cause any symptoms, which is the reason most people do not consult a doctor. Despite remaining unnoticed and untreated, most of the time, low hemoglobin has its own set of symptoms. It is a protein in the red blood cells that carries oxygen throughout the body. The most recent studies indicate that anemia affects 33% of women of the reproductive age globally between 15 to 45 years of age. So, are there any modifications that need to be done in the diet for anemia? There are several things that you can do to raise your hemoglobin count through dietary changes and supplements. Make sure you stay in touch with your doctor while you try to raise your hemoglobin count. Your doctor may assess you for symptoms like general weakness and fatigue, shortness of breath, dizziness, mouth ulcers, headache, pale skin and brittle nails, rapid heartbeat, poor appetite, easy bruising and lack of clotting even after 3 to 4 minutes, weak bones and joint pains, sore tongue, inability to focus and concentrate, and some rare symptoms like preference for non-edible foods like sand, gravel, chalks or ice cubes called the pica syndrome. Depending on the underlying cause and the changes you make, it can take anywhere from a few weeks to almost a year to raise your hemoglobin count. Anemia treatment plans often include dietary changes. The best plan for anemia includes foods that are rich in iron and other vitamins essential to the formation of hemoglobin and red blood cell production. Hemoglobin is full of iron. Well, there are two types of iron in foods called the heme iron and non-heme iron. Heme iron is found in meat, poultry and seafood. Non-heme iron is found mainly in plant foods like leafy greens, spinach, beans, nuts, seeds and certain foods which are fortified with iron. So iron can be a rich source in vegetarian as well as the non-vegetarian diet. Although anemia treatment plans are individualized, most require about 150 to 200 milligrams of elemental iron per day. A lack of folate and vitamin B12 may also impact your body's ability to make red blood cells. When following a diet plan for anemia, remember these points. Don't eat iron-rich foods with foods or beverages that block iron absorption, which include coffee or tea, eggs, foods high in oxalates and calcium. Eat iron-rich foods with vitamin C-rich foods such as oranges, tomatoes, strawberries to improve the iron absorption. Eat iron-rich foods with foods that contain beta-carotene such as apricots, red peppers, carrots and beetroot to improve the iron absorption. Add foods that are rich in folate and vitamin B12 to support the red cell production. While inadequate dietary intake of the above nutrients like iron, vitamin B12 and folate are primary pathways leading to anemia, nutritional anemias can also result from increased losses like blood loss from parasites or associated during the process of childbirth or heavy menstrual losses, all leading to iron deficiency. Or high intakes of foods rich in tannins and phytates like tea, unripened fruits, legumes and chocolate, hence further impairing iron absorption. So hope you found this video helpful. Thank you for staying tuned. Do like, share and subscribe to the White Coat Doctor channel for more health and lifestyle updates. And do not forget to ring in the bell icon to receive new video notifications.